Duct of Wirsong, sphincter of Adi, and Impuli Vader. Oh my, it's Model Monday, and today we're going to take a look at the accessory structures of the GI tract. So here we have the liver, here we have the pancreas, here we have the gallbladder, and this is the duodenum or duodenum, depending on which syllable you put the emphasis. Now, the liver, this is where we're going to create our bile, and it's going to be drained via this duct here. This is known as the hepatic duct. Okay, that's the duct that drains the liver. Then we have this sort of gallbladder that's drained by this duct here, known as the cystic duct. Right? And when those two come together, here you have the hepatic duct, there's the cystic duct, where those two come together, this is known as the common bile duct. The common bile duct is going to drain down to here. Now, we have a duct here that's going to drain the pancreas, and that's going to be known as the duct of Wirsong, or the pancreatic duct. Those two things are going to merge. They're going to come together like this, right? And they are going to form what's called the hepatopancreatic duct. And where they dump in, there's going to be a sphincter there, and that's the sphincter of Adi, or the hepatopancreatic sphincter. That sphincter can sort of contract or close, and when the liver is producing the bile, if that sphincter is closed, the bile will back up this way and flow or get stored inside of the gallbladder. When that sphincter opens up, it can drain down into the duodenum. Now, right where that sphincter is, the two ducts sort of come down, and there's this large opening where they sit right here at the entryway of the duodenum or the duodenum. And that large opening, that is the hepatopancreatic ampulla, or what some people refer to as the ampullae of Vader. So we have the liver, the hepatic duct, gallbladder, cystic duct, common bile duct, pancreas, pancreatic duct or duct of Wirsong, hepatopancreatic duct, the sphincter of Oddi or hepatopancreatic sphincter, hepatopancreatic ampullae or ampullae of Vader, and then all of this stuff, the bile plus the pancreatic contents, are going to dump into the duodenum, which is where the 180-degree turn of the intestines is. Liver, pancreas, duodenum. I know. Later.